Many of you are familiar with the concept that there's a connection between mind, body, and spirit, and no discussion of healthcare would be complete without talking about mental health. Come along with me as I speak with the folks at the Suicide Prevention Partnership. Hey, you guys. I'm here with Janet Carnes, the Executive Director of the group. Thank you so much for having us here.
Well, thank you for coming.
You know, Janet was on the radio show, our radio show, Insights, and said some very profound things about the state of mental health in El Paso County, and that's one of the reasons I wanted to speak with you.
Okay.
We're in dire straits here, aren't we? There's not a lot of help.
We're in dire straits. For certain populations, it's worse than others.
Okay.
But when you look at the suicide rate and the amount of help that's available, that's what I think is leading to the crisis.
Right, and we do have a very high suicide rate here in El Paso, in Colorado Springs.
Yeah, Colorado ranks 6th in the nation, but Colorado Springs, El Paso County is one of the highest suicide rates of all
It's
Colorado.
even higher.
Yeah.
It's even higher, right.
Yeah.
And so is drug and alcohol abuse. It's
Correct.
number 3, I think. So that's not a good thing. So you said certain populations are more at risk than or affected than others. What are those populations?
Well, people who have lost their jobs and therefore lost their insurance.
Health insurance.
So the people who are the uninsured or what we call the underinsured.
Underinsured, don't have enough.
Correct. So we'll talk to people on the hotline who will say, well, I have some insurance, but it's a $5,000 deductible if I go for any mental health treatment.
Were you talking to me last night?
So,
No, I'm just kidding.
yeah. So, that's the problem. They can't afford it. And
Right.
the other problem is that people in El Paso County assume, because there's so many agencies that sound like they do help, and there are agencies that do wonderful jobs. The problem is some of the largest ones are only taking Medicaid patients.
Right.
So
They
you can't get in.
Right. They don't serve the underserved,
Correct.
which is a problem.
Big problem. And then you have people, there are other agencies that do provide mental health, but they have like 6-month waiting list.
That's what
Or they'll tell me there's 4,000 people on the waiting list. And when you're suicidal, you can't wait to be number 4001 to get treatment.
Right. I mean, I know that when I lived in New York City, there was a place, and there was a person I knew that was suicidal, and I called for a bed, and there was a 2-day wait. And I thought that was horrible. But here's months and months. So,
Correct. And then we had another source, with a university that was providing counseling. So we start referring there. And then I called there a couple weeks ago, and they're like, we have a 3-month waiting list now. Now they're willing
and this
to
is
take
for people who are suicidal.
Right, but people now,
Not
in
just
fairness to them though, people who are suicidal, they said if they'll say that on the intake, they'll get them in faster.
Okay.
But usually when you're talking to someone who's suicidal, you need like the next day, that day. So we end up with people going to the emergency rooms.
I was going to say, what do you do with people who? Oh, and I should backtrack a little bit. You have a 24-hour hotline, is what we're talking about.
Right, there's a hotline that
And
they can call.
What's that number?
It's for here it's area code 719 and then 596-5433.
Okay.
And we have teamed up now with Metro Crisis Line in Denver.
Great.
And so it's fabulous because they're on site 24/7, a lot more bilingual. They all have master's or doctorate level training.
Oh, that's
so
fabulous.
that is going to help fill a gap for immediate.
Yes.
But if you need to be hospitalized, that's another story.
Right. So okay, let's say I was suicidal and I called the phone line, the hotline. What would I hear from you? We can't get you a bed, or would you tell me go to the emergency room?
Well, it depends on what the risk assessment shows. So if we feel like that you're in danger to yourself or someone else, then that's the time where we need the police probably to escort you to the hospital or to get a relative to take you to an emergency room.
Wow.
And we do that because they need immediate care.
Right.
And also
I mean,
for
suicide
liability
doesn't
issue.
when you're desperate enough to call a suicide hotline, it doesn't seem like it's something that can wait.
Right.
So.
So if we feel there's a danger issue, then we have to refer you to an emergency room.
Okay. And before we wrap up, what can people do to help? Your organization, or just in terms of awareness? I guess donations.
Well, donations, because
you're a
that's the
charitable.
other thing. People assume that because we're suicide prevention that we receive city and county and state and federal funds, and none of that's true. So we have to depend strictly on donations, some small
kindness of
grants,
strangers.
and tons of volunteers.
Okay.
So volunteers make everything happen.
Okay,
the Children Left Behind program, professional therapists, but they're all volunteers.
Wow.
The other big thing we need to do is to change the stigma.
Right.
And that is the stigma of suicide. People who die by suicide are in great pain.
Right.
And so people think they're being selfish or cruel, and it's not. They're in great pain.
Right.
And so we need to change
We've
the
talked
stigma.
before. I've had family members commit suicide, and it's very painful for those of us left behind, but you have to realize that for them to do that, take that action, they had to be in such excruciating pain that was their only option.
Right.
So,
and then the last thing I think we need to do, if we have time for this, the last thing that we need to do is also get people just to not only understand the stigma, but the magnitude of it.
Right.
I mean, 155 people die a year, and we say, oh, that's sad, and that's more people that died in car accidents and homicides.
Right. So it's a really serious issue. Thank goodness that you're here.
Well, thank you.
Thank you so much, Janet.
Okay.